Namaste and good afternoon. How have you been? Welcome to the Facebook Live series presented by Apollo Hospitals. I'm Dr. Srinidhi Chidambaram. We have been running these Facebook Live programs regularly so that there is awareness and knowledge on health, disease, and lifestyle, as well as the latest treatments and innovations in medical care. Radiation therapy is a type of treatment for cancers that uses beams of intense energy to kill cancer cells. It damages the cancer cells by destroying the genetic material that controls how these cells grow and divide. And the goal of radiation therapy is to destroy as few normal and healthy cells as possible. There have been innumerable advances in radiation therapy, and the advances are accelerating, in fact, creating new options for treatment and definitely new sources of optimism and hope in the fight against cancer. So we think you should learn about these tremendous new innovations that give real hope of conquering cancer. One such is the TrueBeam radiotherapy system with velocity that has been recently launched at the Apollo Cancer Institute, Apollo Health City, Hyderabad. It is a magnificent innovation in cancer care capable of treating a wide variety of cancers with high accuracy and precision, and allows oncologists to treat many types of complex cancer cases. And it's also extremely beneficial to the patients because of the comfort, accuracy, and speed of the system. And also the specialized software, Velocity, organizes patient data and makes it very easy for oncologists and clinicians to make more informed treatment decisions. We thought it would be interesting and important for you to know of the latest innovations in the fight against cancer and this fascinating system. To discuss this topic, which is the latest radiation technology in treating cancer, TrueBeam STx with velocity, I welcome Dr. Vijay Anand Reddy, Director, Senior Consultant, and Radiation Oncologist, Apollo Cancer Centers, Hyderabad. Dr. Reddy is well known as both an astute clinician and a caring and spirited cancer crusader, empowering his patients with the love, hope, faith, peace, and courage that is so important to conquer cancer, and also has been creating awareness in the wider society, providing them with the strength that only awareness can give. Dr. Reddy is presently the Director and Senior Consultant Oncologist at Apollo Cancer Hospital, Hyderabad, a veteran in the field with academic qualifications from reputed institutes across the world, and a medical practice extending over 20 years. Dr. Reddy has handled over 10,000 cancer cases since 1992 with extraordinary outcomes, and has also won several prestigious awards and has been a guest faculty in over 500 CME programs and over 60 publications. One of his landmark initiatives is the Cure Foundation, established in 2003. The selfless activities of this foundation has made lives better for scores of people through cancer awareness, screening, anti-tobacco campaign, etc., and has also been involved in giving support to the terminally ill patients. The tobacco ban, in fact, came from the untiring efforts of Dr. Reddy in sensitizing the government of Andhra Pradesh and the Municipal Corporation of Hyderabad. Hello, Dr. Reddy. Welcome to our program, our Facebook Live program. Thank you so much for joining us. And over to you now to talk about this latest innovation that we have launched.
Thank you, Ms. Srinidhi Chidambaram. Pleasure to join this program. It's always a pleasure to talk and do this kind of awareness programs so that the people should understand what's going on in the field of oncology. Especially, there are so many myths about the cancer treatments. People do not come for the treatment just thinking that the treatment is so difficult to take it and so difficult, so many problems that they are going to go through. Typically, they would say, rather, I would die rather than I go for the treatment. So such unfortunate situation. Some of the patients are so biased about the cancer treatment. Of late, you should understand that there have been phenomenal changes, advances in the field of oncology. You name surgery, You've got robotic surgeries, minimal invasive surgeries. Then as far as the medical oncology is concerned, you've got apart from chemotherapy, you've got targeted therapy, immunotherapy, which actually target the cancer cells and not the normal cells. So you always invariably have less side effects. And then coming to the radiation treatment, which was earlier in the past used to be a burning and charring and skin burns, and patients used to discontinue the treatment in the past. With the computer technology coming, having so much phenomenal developments in the computer technology and so on so forth, the radiation equipment, which is mainly computerized and controlled by the computer technology and the software and hardware. So we are able to advance a lot of advances in the radiation delivery system, and hence nowadays the radiation treatment has become much easier for the patients to go through the entire treatment process. Now, as we know, the advances that Apollo has always been in the forefront to get the best of the best technologies that are available in the world. As we are advancing and getting the best technology to get the patients, our patients, the best of the best treatments at their doorsteps. Whatever is available in the Western world or European world, in fact, very few centers in the European and Western world have this kind of an advanced technology where our chairman would get it to in India to all the major centers in Apollo Group. Coming to Hyderabad, we have the latest gadgets, which we are all really proud of, is TrueBeam STx with Velocity. It's a new radiation technology wherein the radiation, so for a radiation oncologist, what is important for us is that we want to deliver certain amount of radiation to the target so that we'll achieve a cure in that particular patient. So there are so many hurdles to deliver such high doses to the target without hurting the normal structures in the vicinity of the tumor. So the advances in the technology in the TrueBeam, that what we are so assured of delivering the desired dose that we would like to deliver to the target is possible and feasible with this new technology. There are great advantages having this technology at Hyderabad Apollo, and we are so happy that we will be able to deliver the desired dose what we would like to the target, and we will be able to achieve higher cure rates with this technology. Number two is the dose rate. Normally, when a patient is lying down on the couch for to deliver a certain amount of dose, it takes around 5 to 7 minutes. With this new TrueBeam STx with Velocity, we are, because of the very high dose rate, within a few seconds, we will be able to deliver the desired dose to the target. By the time the patient realizes the treatment is done, and he will get up and walk out without knowing that the treatment is done. It's fairly very simple. He will not even feel, he will not even know that the treatment is done. It so happens most of the time when the patient is lying down on the couch, he becomes restless when the treatment is going on. It might even take 5 to 6 minutes. So that problem is also solved with this new technology called TrueBeam STx with Velocity. Less than a minute, you are completing the radiation treatment. Added to that, we used to normally fix the patient in some kind of immobilization device on the face, on the chest, or on the abdomen. So with this new technology, the image guidance of this TrueBeam STx is so good that the precision of the beam which is entering the patient is 0.1 to 0.3 millimeter accuracy. So we are so sure that the treatment is delivered where we want to deliver, and then the immobilization of the patient is not truly required because of the machine has got a CT scanner and an X-ray machine which verifies the patient position, verifies the target, whether it is in position or not, if there is any movement in the target, if there is any discrepancy in the movement of the patient versus the movement of the target. All those things are nullified with this new technology because it is superimposed by a CT scanner and an X-ray machine. They make doubly sure, 100% sure that the target is in place and the beam is entering the target. So with that kind of a technology, we are able to minimize the treatment time as well. For example, earlier we used to go for radiation treatment for a period of 5 to 6 weeks to even 8 weeks. With so much of assurance, with this new technology, we are able to deliver the entire dose of radiation in 1 to 3 days as well. So that kind of a technology, that kind of a confidence, that kind of a precision is available with this new technology. So that helps immensely the treating physician, treating radiation oncologist, and we are able to deliver such kind of doses in no time with high precision and high velocity.
Absolutely. We will now look at a few questions,
Sure.
if I may. This, apart from the speed and the precision, there is also an element called the velocity in this equipment. So what does that do, Doctor?
So that means the velocity of the mission is so high, we are able to deliver the high dose of radiation. For example, you're delivering 3000 centigrade in a fraction of a minute. So the beam velocity of the mission is so fast that you're able to deliver such high doses in such a shorter period of time.
Are there any different radiotherapy options that this particular machine supports?
Exactly. So this is a mission with so many facilities in it that we can deliver a standard kind of a treatment for 6 to 8 weeks. We can deliver stereotactic radiation, which is called like a beam, which is as good as a surgeon's knife. So we are able to deliver, for example, you have a lesion in the lung, which need to be operated, which can have an alternative option of delivering the treatment called stereotactic radiosurgery and treat this lung tumor with 1 to 3 days of treatment, and there is no bleeding, no side effects, and the patient will walk out without any surgery, need of surgery. So such kind of treatments can be delivered with this technology. You have a tumor in the brain, which can be delivered, which can be treated in 1 to 3 days. You have a tumor in the liver, which can be treated in 1 to 3 days. So without using a knife, without requiring to undergo such major surgeries of resection of a lung lesion or a brain lesion or a liver lesion, we are able to deliver the same kind of cure rates with this radio knife, which is called radiation knife. We may call it a stereotactic radiosurgery. So all kinds of possibilities and are there with this TrueBeam technology, right from palliative care to radical treatments, from 6 to 8 weeks treatments to less than 1 week treatment or even 1 day treatment.
What is exactly the rapid arc technology in this TrueBeam?
Right. So when you are visualizing a target, for example, if you have a lesion in the lung, you imagine that the tumor is in this shape. In this angle, the lesion, the size, and the imagine a bird is sitting like this. If you are looking at from this angle, you have a different shape of the bird. Same thing if the beam comes down, and if you are looking at from this angle, the shape of the bird is completely different. And imagine this camera is moving in 360 degrees and visualizing the target and getting the shape of the target in different shapes and still holding the beam around the target. So that is the greatest advantage of rapid arc. That means the beam rotating, the vision of the entry, the gantry beam rotating around the target in 360 degrees and delivering the radiation, taking the shape of the target is the beauty of rapid arc. And in every angle, the beam, when it enters the patient, it will modulate and takes the shape of the beam, takes the shape of the target and delivers the radiation to that particular shape, to that particular target in different doses. For example, in this peak of the bird requires higher dose, the tail of the bird requires lower dose. That can be monitored. That means it can be modulated. The 200 centigrade, which is given in this target, can be modulated in different angles and different areas. One area getting higher dose, one area getting lower dose. So that is the beauty, and the modulations will be 6 to the power. It's almost 60 lakh modulations can be delivered with this rapid arc rotation.
So which are the cancers which are commonly treated by this method?
Honestly, every cancer can be treated with TrueBeam STx velocity. Whole body radiation for a bone marrow transplant can be done. Entire body, wherever the tumor is, it could be a tumor in the scalp, with tumor in the head and neck areas, breast, lung tumors, abdominal tumors, pelvic tumors, everywhere, based on the size and shape and the type of the target, we will be able to deliver high dose of radiation, and we will be able to get higher cure rates with this technology.
And is there any variation in age? Like, is there any age group which cannot take this, or is it adjustable for all age categories?
That's a wonderful question. So as I mentioned, in an elderly age group, for a patient to lie down on the couch for a longer time would be very, very difficult and be very uncomfortable. And most of them will have claustrophobias. All sort of problems would be there. With this technology, patient, by the time he lies down, by the time he realizes that he is lying down on the couch, treatment is done. So for the elderly people, it's actually very, very advantageous. Similarly, for a child, normally they won't lie down on the couch without their parents being there in the room. So we have to treat them with anesthesia. So when we do anesthesia, the anesthetist would request us to finish off the treatment as fast as possible. So that is possible with this technology. Even small children whom radiation is required, we will be able to deliver in a very fast way with high precision without hurting the especially it's very, very important in children that the adjacent structure should not be getting radiation because they are growing children. So any type of tumor at whatever age, TrueBeam STx with velocity has got a great advantage.
Now let's talk a little bit about what are the preparatory steps before somebody goes in for this treatment. How does the process start?
It's a long process when a patient comes to us for once we discuss in the multidisciplinary tumor board, and then we decide this particular patient requires radiation. Then he will come to the radiation department. Then we would take the patient. We would normally do a CT scan. We'll do a PET CT scan and then an MRI scan and sometimes an angiogram if required. And all those three scans are merged to each other, and then we get a tumor dimension in multiple angles and multiple sections, what you call it as axial, coronal, and sagittal sections. Then we get a three-dimensional form of the target and also the structures which are in vicinity of the tumor, which will be seen with the superimposition of these three scans. And then we take the patient, we'll take these scans into the treatment planning, which is called radiation treatment planning systems, which is going to, we have to sit there and spend 48 hours to 72 hours to design various angles and beams to reach the target and to reduce the dose to the surrounding structures. So that's going to take around 48 hours. And then entire thing, what is we designed on the computer has to have a quality assurance. So we go and do it on a dummy body and execute the treatment on a dummy body and make sure what is seen in the computer is exactly happening in a body. Then we call the patient for the treatment execution. On the first day of the treatment, execution of the treatment would take almost 15 to 20 minutes because we have lasers, we have CT scanners, we have X-ray machines to verify what exactly we did it on the computer is simulating on the patient himself. So on the first day, it takes 15 to 20 minutes to make sure that everything is in place, everything is in matching. Then the treatment is executed. From the next day onwards, as I told you, it's going to be less than a minute.
And are there any instructions that the patients are given before they come for the radiation treatment?
Yes, we do spend a lot of time with the patient, tell them how to deal with you while undergoing the treatment. It includes taking care of the skin, taking care of their body, taking care of their mind, and the diet. So what kind of diet that they need to take while undergoing treatment that is different from head and neck cancers, cancers of the thorax and abdomen. We would do a dietetic counseling, psychosocial counseling, and do's and don'ts during radiation treatment. All those things will be clearly explained. And while undergoing treatment in Apollo, we make it a point, apart from the radiation technologist, a doctor also would be there in place while the execution of the treatment is going on. And every week, patients will be reviewed by the senior consultant to look at the problems and the side effects of the radiation treatment. During the length of the treatment, patients will be seen by a senior consultant. We would take care of the small issues that they get through while the radiation is going on.
And are there any side effects that will be manifesting after these?
Correct. So most often in this era, the side effects have been very, very less, especially with the technology what we have. The side effects would be very less. But nevertheless, there will be some kind of like if you are treating a tongue cancer, then in the vicinity you might have soreness in the oral cavity and soreness in the throat when you're treating the neck, for example, in the throat cancer. Similarly, when you're treating the chest, you might have some soreness while swallowing. You might have dry cough. These are quite more tolerable, mild kind of side effects, which can be normally happens in the later part of the treatment. Initially, for first 2-3 weeks, you will not find any, and later part of the treatment, certainly you will have this kind of soreness. Those soreness related issues can have nausea, vomitings, occasionally vomitings, and you might have diarrhea, you might have hyperacidity. These kind of issues can develop, but very unlikely to have any kind of skin reactions. Any kind of serious side effects are not seen these days with this kind of technology.
Recently, there was some myths going around, or people sometimes have this false perception that when they take radiation treatment, they themselves will become kind of radioactive or something. So what would you like to say to those patients?
It's a very important question, Dr. Srinidhi. So usually there is a myth that patient who is undergoing treatment other people should not even touch him. So radiation is just a fraction of a second. When the patient enters the radiation room, there is no radiation. When the patient is lying down on the couch, we all come out of the radiation room, switch off, close the doors, and when we switch on the treatment, it is only a fraction of a second the radiation comes out of the machine and it enters the patient's body. And within a fraction of a second, it disappears. There is no radiation outside or inside the patient once the treatment is delivered. So once he moves out of the radiation room, he can definitely mingle with people, touch people. There is no radiation coming out of the patient. There is nothing which is contaminating from the patient to the attendants or anybody for that matter. So there is nothing like that. It is just a fraction of a second. It enters and disappears.
Absolutely. I think we have covered the entire aspects of this generally radiation, but also particularly the TrueBeam STx and velocity that has been recently launched. Thank you so much, Dr. Vijay Anand Reddy, for this wonderful discussion. And viewers, I'm sure you found this information useful. And also, this information, I'm sure, has sent out a message of positivity and optimism to those who are battling cancer. If you have any further queries or questions, you know that you can always reach out to us on our social media channels. You can put in comments on our Facebook page. And for more information, you can definitely look at our website and our YouTube channel for the latest information on health and healthcare. Please subscribe to our YouTube channel. And if you have more queries, reach out to us. Until we meet again, take care and see you soon. Thank you and namaste.